Hi, I'm Lizzie, and I'm a mental health liaison nurse specialising with the older adults, covering both Cheltenham and Gloucester Hospital.
My name is Viv Kemet. I'm also a mental health liaison nurse in the same role as my colleague here. And today we're here to talk about anxiety, something that we've all experienced. Isn't that right, Lizzie?
It absolutely is, and I'm actually experiencing quite a lot of anxiety now, to be honest.
Yeah, I think we're both feeling quite anxious about this, but we're going to try and rally on and do it. So what we talked about, Lizzie, was what is anxiety? Mm-hmm. And I think we came up together with what we thought was a good definition. And basically, it's a feeling of unease, such as worry or fear. And it can be very mild, or it can be quite severe and actually be a mental illness. And we've all, as we say, we all have feelings of anxiety at any time in our lives. And it's an emotion which is characterised by feeling of dread over anticipated events. And Lizzie and I definitely were feeling dread this morning over this event. It's different from fear, anxiety that it is. It's different from fear in that fear is defined as the emotional response to a present threat, whereas anxiety is usually in anticipation of an event. So that's the definition we've decided on anxiety.
Yeah.
And then we need to say, the other thing we were talking about is how common is it? Well, it's extremely common because we all worry about stuff, don't we? Particularly about things that are about to happen or which we think can happen. And then we go through all kind of scenarios in our mind of what could happen, what may happen, what if. And actually, a lot of the time, the things that we really dread, the worst scenarios, don't come about.
When we're thinking of statistics with regards to anxiety, between the 20th of March and the 30th of March, 2020, almost half of people in Great Britain reported high anxiety. This was much worse in comparison to the previous year in 2019. And this equates to over 25 million people out of the population aged 16 and over. Over to you, Viv.
Okay, and that was sourced with regard to personal and economic well-being in Great Britain, May 2020, which was commissioned by ONS. So again, then we looked at, if there's so many of us are feeling anxious, as my colleague said, are some of these people ashamed of how they feel, of the anxiety? And on one study, the Mental Health Foundation worked with Oppenham to conduct an online survey of 6,000 UK adults aged 18 plus. This was in March 2023. And despite anxiety being so common, it seems stigma and shame still play quite a part. Almost half of those people, 45% of them, polled, said they kept their feelings of anxiety secret. This suggests that although there has been progress in discussing mental health issues more openly in recent times, significant numbers of people are still not comfortable talking about their own experience with anxiety. Okay, so Lizzie, do you want to say a little bit about fight or flight?
Yeah, so when we're thinking of anxiety and I suppose and fear, we look at the fight or flight freeze response in regards to the body's natural reaction to danger. And unfortunately, it's not something we have any control over. It happens through hormonal and physiological changes that allow you to act quickly so that you can protect yourself. And it's a survival instinct that our ancient ancestors developed many years ago.
I think that, like, an example for that would be if a guy came through this door now with a baseball bat and was intent on kicking the hell out of all of us, we would, all of us, go into fight or flight or freeze.
Yeah.
And the brain gets the body ready by releasing those hormones and cortisol, etc., to make us the biggest and the strongest we can be to either run or fight.
It can be sometimes quite surprising what our body actually does, as far as unconsciously in response to danger.
Yeah.
We may react to something that actually is quite unexpected.
And people have been able to lift cars off people with the amount of adrenaline the body's putting through the system.
Yeah.
Greatly increases the strength.
Yeah.
It's great in times of real danger because it can actually save your life or someone else's. However, it can also, the brain can also actually give the fight or flight response to perceived dangers and not actual dangers. And then those chemicals that go around the body, they don't get used up in the actions of fighting or running, so they float around the body, and then you've got physical symptoms of anxiety, which, if I kind of say a few of them, and
Absolutely.
then you...
Yeah, no problem.
I mean, your heart rate, for a start, your heart beats faster to bring oxygen to the major muscles to make you, as I said, the strongest and the meanest fighter you can be, or the fastest runner. The lungs, well, the breathing speeds up to deliver more oxygen to your blood. And even your eyes, peripheral vision increases so you can notice your surroundings, and pupils dilate to let in more light, which helps you even see the threat a bit better.
So your ears, your hearing becomes much sharper, so things may seem a lot louder than they usually are. Your blood thickens, which increases clotting factors, which prepares the body for any injury. And then pain. So fight or flight temporarily reduces your perception of pain as well. So in order to provide extra oxygen to the major muscles, the brain may shut down body systems not needed to run or fight, such as the digestive system, which can lead to physical symptoms of anxiety, such as stomach or digestive problems. Freezing is a fight or flight on hold, where you further prepare to protect yourself. It involves similar physiological changes, but instead you basically stay still and get ready to move. Do you want to say the next bit, Viv?
Yeah, fight or flight or freeze, as I said earlier, may save your life in situations of real danger. But if someone is faced with a perceived threat, the brain may think they are in danger. And as a result, the body may automatically react with fight, flight, or freeze response. And that's, as I say, why it's advocated that if you do have problems with anxiety, that physical exercise is extremely good, because it can get rid of some of the hormones that are floating around your system. So, the symptoms of patterns of anxiety. So, there's quite a few of them. These are some of them. You can have trouble concentrating or making decisions, lots of ruminating thoughts going round in your head, feeling irritable, tense, restless, hypervigilant because of all the adrenaline going around your system, nausea, abdominal distress, heart palpitations, sweating, trembling or shaking, trouble sleeping. Sleep deprivation seems to be a major contribution in anxiety. And again, this hypervigilance of the sense of impending danger, panic or doom. Mm-hmm. So we've established that all of us feel anxiety to a certain level. Mm-hmm. And then handing over to Lizzie, when does it, or is it a mental illness?
So anxiety itself is not a mental illness. It's an emotion. And as Viv mentioned, most people experience anxiety at some point in their life. There's just different, degrees of which it affects us, and actually how it affects our everyday life, our well-being, and our functioning as well. So if the anxiety becomes debilitating, significant, and it stops us from functioning and living our lives freely, then it may become more of a serious concern and a symptom of a mental illness. Some common anxiety-related disorders such as post-traumatic stress disorder, generalised anxiety disorder, panic disorder, and obsessive compulsive disorder. There are also other mental illnesses such as depression, where a symptom of anxiety may be evident and obviously as part of many other symptoms.
I think one of the things that I think is that when I'm anxious, that everybody can actually see that I am, and it provides the picture of, like, you know, the kind of swan or duck in the water, which is completely serene on the top but pedaling like mad at the bottom.
Yeah.
Do you think that people can actually see when you're anxious? Because I know, working with patients who've said it, they think that people can see it, and one of the things that I say to them is I don't think they always can see how anxious you are.
And I suppose everyone's experience of anxiety and how we deal with anxiety is very, very different. Some people may look like they're panicking and hypervigilating on all those kind of common and what we think as sort of normal symptoms of anxiety. But actually, if someone's completely maybe shut off or withdrawn, we have no idea that they may be feeling really, really anxious underneath that kind of exterior. So yeah, completely.
Okay. So, which leads us on to panic attacks, really. I mean, I don't think I've ever experienced a panic attack.
No.
Because people describe it as if you're maybe having a heart attack, feeling they're going to die, and they think they come out of nowhere, where the evidence is that they actually don't come out of nowhere. There usually are some triggers that just make me further.
Yeah.
So, which leads us on to a description of panic attacks.
Yeah.
It's a type of fear response.
Yeah.
And an exaggeration of your body's normal response to danger, stress, or excitement. And some of the symptoms,
So, yeah, I suppose very similar with regards to anxiety, but a lot worse usually as well. Feeling quite lightheaded, feeling as though your heart is racing, sweating profusely, feeling quite nauseous. And it can be very, very frightening, very, very frightening. But it's not dangerous, and it is only temporary as well.
your brain will actually stop it after a while.
It will.
Yeah.
Yeah.
I think it just feels like forever, doesn't it?
Yeah, and most panic attacks last around between 5 and 20 minutes. And again, I suppose people's experience of panic attacks is completely different. It differs from person to person. Some people may experience them once, I don't know, some prior to an interview or something like that, and never experience it again. Some people experience it a bit more frequent and a bit more regular, and that's when it maybe needs to be looked at by, GP, healthcare professional, to stop it from happening again. And actually maybe looking at the root cause of it and actually what can be done in order to reduce the occurrence of that panic attack.
I know I said I've never had a panic attack, but I think I probably have. I think if it's akin to feeling, I've had it when I've had a near miss in the car.
Yeah.
When it's suddenly you've just swerved up to miss something, or it's just, and you really feel that sense of panic and heart thudding and sweating. So I guess that would be a panic attack.
Yeah, absolutely. Yeah.
So how would you help someone who's having a panic attack?
Don't panic.
Easily said.
So I suppose if you if a friend is it looks like they're having a panic attack, or a colleague, or on someone in the street or something like that, it's very really, really important to keep calm. And I suppose talking to them very calmly, focusing on the positive things, try to reframe try to encourage them to focus on one thing, such as their breathing, focusing on, slowing that breathing down, and reminding them gently that this feeling will pass. It's not dangerous, it's not threatening. And I suppose, just being there to support them through it, really.
Would it also be a case of perhaps bringing, because when we look at things like the primitive brain, which is usually, which the primitive brain is what is in gear when you have a panic attack, it's like when you say like getting them to breathe, it's about bringing the thinking mind
absolutely
back into play, isn't it?
Yeah.
And I think we do that quite a lot ourselves when we're anxious. Because I don't particularly like lifts.
I hate lifts. Yeah.
So with the GRH, when I'm going to the lifts, and I couldn't get into it if it had more than a couple of people in.
No. Yeah.
So basically, it's up the stairs.
Yeah.
But I kind of argue with myself on the way and say, look, have you ever been stuck in a lift?
Yeah.
And the answer is no. And it's unlikely that I would be.
Mm-hmm.
And so you do bring in the thinking mind, which tries to have a reality-based argument of your fear or your anxiety. But it's still not enough to get me in the lift doors if there's more than 2 or 3 people.
No, absolutely not. No.
Okay.
And I think, absolutely, it's about focusing on your breathing, and it may be that actually you kind of mirror what you should be, how you should be breathing. Close your eyes and breathe through your mouth. Breathe through your nose and out through your mouth with that person in order to kind of mirror what you should be doing or should try to be doing.
So okay, I guess would medication be anything that you might use here?
Yeah. So there is a role for medication. Psychiatric medication, also known as psychotropic medication, is a type of treatment used with the intention of reducing symptoms of a mental illness and preventing the likelihood of relapse, a reoccurrence of that illness. Types of medication including antipsychotics, anti-anxiety, there's mood stabilisers and minor tranquilizers or sleeping pills, which include benzodiazepines. When someone is having an acute anxiety attack, they have usually lost all of their coping strategies and are in significant distress. Minor tranquilizers can be used in order to manage their distress at that time. When that anxiety is extremely acute, it's severe, and actually no other ways are felt to be effective. Other treatments include counselling, cognitive behavioural therapy, arts and crafts therapies, ECT, and alternative therapies such as yoga or medication or mediation. But again, that's more sort of long-term treatment as opposed to sort of treating the here and now.
I get it, really. I mean, before I came over to your team, I worked in the working age team, which meant I spent quite a bit of time down the emergency department. And it used to make me quite disturbed to see doctors not treating someone who was in like a state of acute anxiety. And they would say, well, can you not go in there and do some strategies with them? And I'm saying at this point, they don't have any strategies. They're, acutely anxious, and it really medication is needed to calm them down, and they need treating. Yeah.
Absolutely.
I mean, sometimes I've known acute anxiety be actually by the doctors there in ED. They think the person's having a heart attack.
Yeah.
It can be that distressful.
It can look quite scary to witness as well.
Yeah.
Okay, so how can you support someone that's experiencing anxiety? It can be very, very difficult and quite scary to know what to do when you do witness this with someone, whether it's a family member, friend, colleague, or just anyone on the street, really. But there are several things that you can do. We've touched on it briefly before, but I suppose just to go into it with a little bit more detail. Most importantly, when someone is experiencing a panic attack, stay calm, don't pressure them, and try to empathise with how they're feeling. Encourage them to breathe slowly, take deep breaths, and as I suppose there's a lot of stigma, and I suppose a lot of stereotypes around using a paper bag with anxiety when someone's having an anxiety attack, but actually that's not advised at all and actually can be quite dangerous. Definitely don't use the paper bag strategy. Offering to attend GP appointments, encouraging them to seek professional help or advice, and just providing a listening ear is sometimes all someone needs. Which goes on to our last question. What are some useful basic anxiety management strategies to help people cope with anxiety? So we've touched on this a lot previously, but breathing involves a cycle of slowly inhaling for 4 seconds, holding the breath for 4 seconds, exhaling for 4 seconds. Important to encourage the person to relax their shoulders when breathing out.
Yeah.
Sometimes it's quite helpful to close your eyes as well, because it makes you completely switch off from the environment around you, and I suppose just be quite present and quite grounded with regards to your situation at the time. And then you've got the 3-3-3 rule. Involves encouraging the person to look around their current environment and name 3 things they see, identify 3 sounds they hear, and then move or touch 3 things. And whilst there is no formal research into the effectiveness of the 3-3-3 rule, many people find it to be helpful and simple technique to handle anxiety in the here and now. Over to you, Viv.
Another basic anxiety strategy, which is quite a lot of people use because it actually makes a lot of sense. So it's called the anxiety rating scale, where you rate your anxiety at any time from 0 to 10. 0 means no anxiety, not a state many of us are in at any time. And then 10 is panic attack time, which is something we talked about before earlier. The good news is there's no 11 or 12 with this rating scale. The worst you're going to get is a panic attack. Extremely, extremely distressing, but it's not going to kill you. So basically, that is what you do. And the idea, Lizzie, you talked about breathing.
Yeah.
I think there's evidence now to suggest that the breathing will help you down the lower end of an anxiety rating scale. But if you're hitting 6, 7, or 8, then it's probably not going to be so effective. Yeah. So with the rating scale, if we again, we've said it before, but if we remember that in times of anxiety or fear and panic, it is the primitive brain that is engaged. And it's the thinking mind you need to try and bring back into play. And purely by just stepping back and rating your anxiety, it brings the thinking mind into play. The other thing that the rating scale can do is, at the moment, I would rate myself on the anxiety rating scale of about a 5 or 6 at the moment. What about you?
Yeah, about the same.
Yeah, because we've kind of got lights, cameras and action going all over us here.
I've got quite a lot of physical
We
symptoms.
could ask
of
you guys,
anxiety
but I don't
going on.
suppose you can speak, can you? No. Well, they look pretty relaxed.
They do look very relaxed.
Yeah, I reckon they're about at least a 1 or a 2, maybe.
Yeah. Minus.
Either way, okay. Getting back to the anxiety rating scale, if you actually do take, if you just practice it, what you can do is, if you're going up the rating scale, you can use strategies to bring yourself back down. I'm now with you. I'm saying I'm about a 5 out of 10. If Lizzie, for some inexplicable reason, you would start threatening, be threatening towards me, I would go, right, I'm going up to 6 or 7. And then I'm going to say, hey, I'm not going to let it go to 8. I'm going to come back when you're calmer and I'm going to leave. It basically, it's a very, very good tool to be able to use for anybody, is the rating scale. So trying not to make this dangle. So again, I suppose if we had to sum things up, it's to remember that the brain is called the chimp in psychological terms for a reason. It's mischievous, and we just have no idea why. Okay, and anyone who's ever listened to a song on the radio that you hate, and then something's singing it in your head for the rest of the day, that's the brain.
Yeah.
We have no reason why it does this, but whereas the human mind, the problem-solving, logical side, if you can bring that into play, can really, really help with anxiety. So thank you very much.
Thank you.
Bye.